Hello everyone and welcome to this webinar focusing on crisis waste management. My name is Marika Palosaari and I work as a program coordinator at the Europe office of the United Nations Environment Programme, UNEP. Today I have the pleasure to moderate this webinar, which is the third of our global webinar series on the theme of environment and emergencies in the face of COVID-19. This series consists of 6 monthly webinars running from July to December, and I would like to thank everyone for the huge success of the series so far. The 2 first webinars that were held in July and August saw an average of more than 1,300 participants from 135 countries. Overall, over 4,000 people have registered for the series so far. This is, of course, a strong sign of an ever-growing demand to learn more about this topic from across environmental development and humanitarian communities. Before we get started with our program today, I have a few brief announcements. Firstly, please do note that the webinar will be recorded. The recording and all materials shared during the event will be made available for all participants. After the webinar, you will also receive an evaluation survey, and we really welcome everyone's feedback, so please make sure to fill in the survey that will help us to further improve this webinar series. I would also like to inform you that a Facebook group has been created to facilitate exchange among all of you and participants of the other series. The creation of this Facebook group is based on the feedback we've received and the suggestion to have a platform for interaction across webinar and beyond the series. The group is not moderated, and any views expressed in the group do not represent those of us organizers. But the group is for you. It's meant to support the creation of a community of practice and to keep in touch for further exchange on this topic. The link to the Facebook group is now being posted in the chat, and it will also be circulated after the webinar. Now, I would just like to give a few introductory words before I give the floor to our speakers. As we have all observed, the COVID-19 pandemic is a reminder that human health is linked to the planet's health. This crisis has also highlighted that environment and emergencies are intrinsically linked. COVID-19 has a foothold in 216 countries, areas or territories. Some of these countries are in crisis because of conflicts, disasters, and climate change. They are home to a large number of people who were already previously in need of emergency assistance. Within UN Environment Programme, UNEP, we are very fortunate to have a solid partnership with the United Nations Office for the Coordination of Humanitarian Affairs, OCHA. Through our joint environment unit, we can rapidly mobilize technical expertise, equipment, and remote assistance to support affected countries in responding to the environmental dimensions of emergencies. I have witnessed the added value of this joint partnership with OCHA, and I have seen that it really helps to connect the environmental and humanitarian communities. As such, I'm especially pleased to moderate the webinar. Our event today will focus on crisis management during the global pandemic. And we will hear about this challenge from 4 experts across the world. Mr. Atul Bagai, head of the UNEP India office, will soon address us with his opening remarks. Mr. Martin Gard, hazardous waste specialist from UNEP REACT Crisis Management Branch, will talk about UNEP and COVID-19 waste management. Ms. Sally Edwards, Regional Advisor on Climate Change and Health from Pan American Health Organization, will give us a presentation about healthcare waste management in emergencies. And our 4th speaker, Ms. Ana Fonseca, Disaster Waste Management Specialist, will share crisis waste management perspectives from around the world. After we have listened to our speakers, there will be a question and answer session. So I invite you all to type in any questions you may have in the question box. We will then respond to as many questions as possible directly in the question box throughout this webinar, and then a selection of them will be answered live during the question and answer session. Now I would like to give the floor to Mr. Atul Bagai for his opening remarks. The floor is yours, Atul.
Thank you, Marika, and I am very happy to be participating in this very important webinar today. I would like to welcome the audience for this third episode of the new global webinar series on the theme of environment and emergencies in the face of COVID-19. There could not have been a more opportune moment and time to be talking of such an important issue, and also through this third webinar where the focus is on crisis waste management. It is very relevant in the face of the present global pandemic. I would also like to, as Marika mentioned, remind of with great honor and pride that UNEP and OCHA are co-organizing this series with the Indian National Institute of Disaster Management, and thankful to NIDM and especially Anilji for this partnership. I'll talk a little about the crisis waste management, and especially in the perspective of the present pandemic. For many countries worldwide, or in fact from all the countries worldwide, waste management is one of the major environmental challenges in normal times. It is a very complex issue that spans from governance issues to physical infrastructure availability, with systems often not being inadequate and overwhelmed, even not to talk about emergencies like COVID. Waste emergencies become, and waste management becomes even more challenging when countries are faced with crisis, whether it is a sudden onset of disasters, be it earthquakes, floods, tropical cyclones, or protracted emergencies such as conflicts. And I would specifically like to highlight this in the Indian context, since there is a large audience from India and it's being co-organized by a very famous Indian institute. India, as you're all aware, is one of the most disaster-prone countries in the world, with large share of its population predominantly depending on agriculture, being exposed to natural hazards with livelihoods and revenues closely linked to weather. According to the Inform Global Risk Index 2020, India is faced with a level of risk classified as very high. In fact, this is the highest classification, with the lack of coping capacity being the primary contributor to overall risk. And it is not just about natural hazards. During the future webinars of the series, we will also hear about, for example, the Bhopal disaster and how that has shaped the way the entire world deals with human-induced hazards. That also is a very important factor to consider. For those of you who may not be very familiar with it, the Bhopal disaster was a gas leak accident that happened in December '84 at the Union Carbide India Limited pesticide plant in Bhopal, Madhya Pradesh, in India. It is considered till date among the world's worst industrial accidents, and it has a milestone event for the global community to come together and address the issue of technological disasters. We cannot also forget that we live in an interconnected world where hazards often do not come alone. We are then faced with cascading or secondary hazards that can sometimes cause even greater negative impacts than the primary hazard, which led them in the first place. Fukushima is often one of the most cited amongst these, with the nuclear accident resulting from the tsunami and earthquake that hit Japan in 2011. What we will hear about this and the Bhopal disaster in the next webinar on 14th October will be very relevant. So please stay tuned for all of you to be connected to the next webinar, which will be held next month. I would like to conclude this section by saying that waste management and related environmental issues have been a prominent feature in every single emergency that India has been confronted with. Coming to COVID-19, we are now confronted with a pandemic which has not only been the latest very powerful wake-up call about the link between environment and emergencies. With over 30 million confirmed cases and more than 950,000 victims globally as a result of the transmission of zoonotic diseases, we are all touched and affected. In fact, it also brings forth a great focus on the close nexus between environment and health. The ecosystem and the biodiversity losses in the last 50 years leading to zoonotic diseases compels the governments to see the close nexus and the link between environment and health. And I'm very happy to say that India is one of the first countries in the world to give prominence to this nexus between environment and health. I'm very proud to announce that just last month, the Ministry of Health and the Ministry of Environment jointly have issued a notification of setting up a steering committee on environment and health so that they can look at this nexus in a holistic manner and not in silos. So this multi-ministry and multi-sectoral approach of India is an example that I think many countries should be following when they're addressing these emergencies. The impact of COVID-19 is transforming the way we live. While national and local interventions are largely focused on protecting lives and economies, management of hazardous waste is also essential to minimize long-term risks to human and environmental health. Developing countries that may already lack proper healthcare and municipal solid waste management practices due to technical, operational, and financial constraints are particularly vulnerable during this pandemic with its new risks and challenges. So developing countries really need to look at this in a very holistic manner. And as I said, most governments have now started to follow existing legislation and regulations put in place by their respective countries for the management of infectious waste from hospitals and households. Further, some governments are continuing to introduce new policies and guidance to follow in handling waste under the COVID-19 pandemic. In addition, governments which do not have their own policies or guidance have taken actions to operationalize the international regulations and guidance issued by different agencies, including WHO, UNEP, UN Habitat, the World Bank, and other UN agencies. And I think this is where the UN has to play a very important role in post-COVID response in all the countries of the world. I would like to finally conclude by giving 2 or 3 very big picture messages that COVID-19 pandemic gives us just a small hint of what we are faced with under the climate crisis, and that linkage is so very important. I would like to also conclude by recognizing that we will be confronted with unprecedented challenges at an unprecedented scale that require that we step up our efforts towards a greener and more sustainable world. We must do this now, and we can all contribute to it. I would finally like to thank the audience and express interest in hearing from the speakers on guidance and best practices on crisis waste management in the face of COVID-19. Thank you very much.
Thank you, Atul, for these thought-provoking and inspirational opening remarks. As we have a rich program today, I would now like to invite immediately our next speaker to deliver his presentation. Martin Gard works for UNEP's REACT program under the Crisis Management branch, and he will give us an overview of what the challenges related to COVID-19 waste management are and what UNEP has been doing so far to assist countries confronted with these challenges. Martin, over to you.
Okay, thank you. I'm very happy to be here to give this presentation. Good morning, good afternoon, good evening. And for Anna, who I know is residing in New Zealand, it's actually the morning of tomorrow. So let me I want to do is to basically be very brief on this presentation, but to give you the fundamentals of COVID-19 waste management. Let me just go to the next slide. Okay, here we go. So essentially, hopefully this presentation will help you to better understand, to handle and to store and to dispose of COVID-19 infectious waste under a range of scenarios that may fit your situation on the ground. What we must realize is that COVID-19 waste should be treated as for all biomedical infectious waste. And if your current systems are dealing with this well, then great, and the system should continue doing what it's doing, but should consider potential for further increases of waste materials, especially if COVID cases increase. So if not, then there are several ways this may be addressed, and hopefully we can show you how this can be addressed. What we must certainly try to avoid is open dumping and open burning. This will increase the risk of cross-infection drilling outside, as this will risk of cross-infection and other health and environmental impacts. We know that COVID-19 virus can reside on various surfaces, as seen in this table, for different lengths of time, but we should be reassured that with correct disinfection, this virus can be easily killed. Okay. So, sorry. Right. Okay, the next slide is basically showing some fact sheets. A range of fact sheets have been produced by UNEP and covering these subjects. I will not dwell on this slide longer, just to say that this is the link to go to for you to download some of these fact sheets to understand various subjects. Okay, it is important to reinforce the need for the use of correct personal protective equipment, okay, when dealing with COVID infectious waste, and this is for all medical and any workers working with the waste. Okay, I'm also not going to dwell on this because our next speaker will elaborate on these aspects. Just to say that these are the links that you will get in the presentation and that you can use to gain more information from WHO, etc., on how to fully utilize PPE in the correct manner. Okay. So moving on, ideally, all sold and infectious waste should be segregated according to type, as can be seen. Oh, sorry, this is that. Okay, I'm missing some pictures on this. Okay, I was going to say, as can be seen in the table in the bottom right-hand picture, but it should be segregated as per the table. Okay, it's imperative that infectious waste are not to be mixed with solid waste, because by doing so, you make all of the waste material infectious, and that would massively increase the overall volume. This should be avoided. Okay, double bagging, ideally color-coded, would help. Otherwise, bags can be clearly labeled with rigid containers for the sharps. Okay, and there's also other information on this slide. Okay, it is important to try to ensure a continued collection system to prevent waste accumulations at source. I'm waiting for the slide, it's very slow and passing over. So the storage should ideally be roofed to protect from weather elements, be well ventilated, prevent vermin, and with clear signage as in the top photograph. The photo below, however, indicates a poor system with the skip overloaded, indicating it is not collected regularly. Rain may enter the waste, causing leachates to filter out. And also, under sunlight like this, the UV rays will quickly break down the bags, spilling the material outside, increasing the risk of cross-infection. COVID-19 waste materials will be treated or disposed through existing medical facilities, or they will be treated on site at the response operation. We recommend that all national medical facilities, there is an inventory throughout the country that will identify the technology solutions that are available and any potential surplus capacity or gaps at specific sites be identified, and in doing so will help to build the preparedness in the case of overburden of COVID-19 waste materials, which can occur with an increase in cases. We also say that sound methods of waste treatment that result in reduced emissions and environmental impact should be the preferred technologies to be used under the best available technology best practice. I seem to... Accountability is key in an effective waste management system, and one person should be made responsible for the facility or response operation in this area. Clear chain of custody is important from generation to disposal, and the waste management team need to be adequately trained on PPE use, handling, segregation and disposal procedures with regular refresher training conducted. For any operators of machinery such as autoclaves or incinerators, they should undergo training that covers effective operations, but also the maintenance. And we would encourage that when you procure any equipment, you should also include key spare parts should be available for its continued use. Now, when you're selecting waste disposal technologies, it's obviously important that you select the right fit for your particular needs, and that these waste treatments are robust over the longer term. This is a process that I would encourage you to go to this website to look at. The SAP methodology is a iterative, criteria-based process that will help you to select under various different aspects. So I would like to show you. Okay, I apologize for that. And so we would suggest that you go to this site, look at the SAP process and use this if you're going to procure any new technology. Okay, so let's move on to the disposal, the options available for disposal of infectious waste. Now, first, this is a hierarchical process I'm going to go through, from preferred technology through to stopgap technology through to emergency technologies that you could use to deal depending on your situation. So firstly, we start with autoclave and sterilization. This is the preferred technology and is considered the clean technology. It basically uses pressure and vacuum, high temperature steam or microwave to sterilize the material that's loaded into the sterilizing unit or the autoclave unit. There's small units, as you can see in the photographs, and also large units, but only advanced autoclaves or sterilizers will normally have shredding as part of the process. The advantages are that there's no emissions, as there are for incineration. Although there may be some odors and potential VOCs, there's no ash to be disposed of, and if shredded either pre or post shredding, there will be a partial volume reduction. However, the remaining waste, because it's sterilized, it's inert and can go to the disposal site, which is usually a landfill. And that's one of the disadvantages. It has to go to landfill, not taking out all of the waste in one treatment. So if this includes PPE, what we would suggest is that PPE be mutilated to prevent waste pickers from reusing from any particular dump site. And this can be resolved by pre-shredding or post-shredding. And we should point out that at poorly managed landfill or dump sites, this material is likely to be open burned by the waste pickers, so it can result in polluting emissions per se. Okay. I'm not very good at clicking to the next slides. So moving on to the next technology, which is the secondary preferred technology, which is commercial twin chamber incineration. Okay, we've got three examples here. These are two medical incinerators, one general waste incinerator. They burn from temperatures from 850 degrees to 1100 degrees in the second chamber, and it's imperative that there's 2-second retention time of emissions in the secondary chamber. What this will do is reduce the volume of the disposed material by 95% through incineration. High quality units can bring about acceptable emissions, especially if they're using add-ons such as Venturi scrub or pollution control system. What we need to realize is when you have a new incineration equipment, you need to properly cure it so it maintains the refractory lining of that equipment. We need to preheat. A lot of people start incineration from cold, and so it's very ineffective. If you preheat your incineration, get your refractory material or heat, it will burn much better. We should ensure that there's mixed feedstocks, not all of one type, so there's balanced burnable materials, and you should be able to do batch loading every 10-15 minutes by carefully opening the hatch and placing these materials in. If they're poorly operated, obviously we will get negative emissions such as dioxins and furans, so we would wish to avoid that. These are higher capital and operating costs because you will be using diesel fuel for the secondary burners. And also the bottom ash for infectious waste should be considered hazardous, and you would have to collect this in 200-litre drums for later encapsulation before sending it to the landfill. And seem to be having control. Okay. So moving on, this is a stopgap solution. So if we can't have the first two solutions, and this is in low resourced environments. Francesco, have you taken back control? Because I don't seem to be having the control on the slide. I want to go back a slide. Can you take over, please? Can you do it for me? So sorry for this, but one stopgap solution in low resourced environments is a De Montfort incinerator. Okay, these are them, and they've been proven, they've followed proven designs that you can see in this following link, and we would recommend the Mark 9 if you are planning to build such a system. They're relatively cheap, low cost. You can build them for less than $1,000. Fire bricks are obviously better, but burn bricks will do. And these designs, as I said, have been tested. They're slightly less efficient than obviously the commercial, even though they have twin chambers, and you normally have to initiate the burn by using some fuel source such as diesel onto the material that you then ignite, and then it pulls through with the induction through the two chambers and the chimney. They're a shorter lifespan, obviously they won't last long, but if it's a stopgap solution, this is fine, and care should be taken not to overload the primary chamber. Next slide, please. Okay, another stopgap solution which you may be able to bring to help you, especially for overburden of PPE, are these barrel incinerators. But I must point out that only barrel incinerators with air induction would we recommend. Okay, there's a couple of links here with sites that sell these products, and they're relatively cheap, around $2,500. There is also an Instructables link here that you can actually build your own and use in a blower, etc. They're very efficient, they're portable, they do burn at a slightly lower temperature, so they may produce some more polluted emissions, so you have to be careful what you burn. But as a stopgap solution, they're ideal just because of their portability and their effectiveness. Okay, next slide, please. Okay, now moving on to emergency solutions. Now this is the least preferred method, and this is when you have none of the other solutions that I've gone through already. You have the option for building a pit. Now what we would say is with this pit, you would want it protected and you would want it on site. You would excavate the pit. You would ideally cover this with a metal frame with downward extending soil pins, which would then hold the frame into place. And with a gauze over the top of this on the doors that you would close each day, and this would be to discourage vermin going into the pit. You would make it clearly signed, and you would ideally make it impermeable by either putting a render or some clay or even cow dung on the inside of it to seal it. And it should be located away from crops, waterways, any water source. The carrying capacity can be anything from 5 to 10 tons, depending on the size. So you may have to dig multiple pits, so you should be aware of this. As they fill up, you should be digging your next pit. Now also, you should be putting a daily soil cover on, and you can disinfect with the placement of a 0.1% sodium hypochlorite solution. This is a solution that you would have to make up from a concentrated solution. What we would certainly not want is any open burning to be conducted in the pit. Next slide, please. Okay, now this is my last slide, and I just want to point out two things here. In this situation when you can't do on-site burial and all you've got available is a land site, local landfill or dump site option, then we would encourage that it could be sent there, but it should be managed and controlled properly, not just dumped. So what we would suggest is that you would hopefully get some plant machinery and you could dig out a trench or even by hand. This is a very large trench, but they could be smaller, 2 to 5 meters deep. And you would take this infectious waste, you would place it in the trench, and you would each day put soil cover, say 5 to 10 centimeters, and build up your layers in this manner. Okay, you should certainly put appropriate signage and hopefully section it off and monitor it to prevent any incursion by the waste pickers, because obviously the risk for cross-infection is very high. At no point should you just simply dump them in the dump sites, because the cross-infection risk is very high. Reuse of used PPE is very high, and also, you know, the consequences on both the human health and the environment. So hopefully I've given you some options. Hopefully, if you haven't considered an option, there's one here that can help you in your COVID-19 response. And I thank you. Pass on presentation. Thank you.
Thank you very much, Martin. Indeed, lots of good advice on possible solutions and options, including some very concrete practical guidance. As I had mentioned at the beginning, all these presentations will be shared after the webinar with participants, so you will have access to look again at some of these very useful information that Martin provided us in detail. Thanks again, Martin. And now we move to our next speaker, who also has a lot of practical examples to share, and as such, she can help us to understand even more about the healthcare waste management based on her extensive operational experience with the Pan American Health Organization. Next speaker is Ms. Sally Edwards, and she will talk about what her organization has been doing to support the COVID-19 waste management and give some examples from the Americas region. The floor is yours, Sally.
Thank you very much, and good morning, afternoon, evening to everybody. I want to thank UNEP for the opportunity to join in the webinar with them and be present today. And for those of you who don't know, the Pan American Health Organization is the regional office of the World Health Organization for the Americas. So what I'm representing here is much of the knowledge of both WHO and PAHO together. So what I first would like to emphasize is that you will notice that there are lots of common themes that have already been presented, and I will continue to present, all with slightly different emphases. But you know, don't think just because we're not saying something we don't necessarily agree. That one of for us the key issues is also the understanding that healthcare waste doesn't only come from a healthcare facility, and especially in the context of COVID, this is very important, that people who are ill at home are also generating infectious waste, and that needs to be considered as such. So when I talk about healthcare waste and some of the issues in managing it, please also recognize that I'm talking about waste from homes, the masks that we're all encouraged to wear, the gloves that people are wearing. And again, having somebody in a healthcare facility or in a system, health system, who oversees the different aspects of healthcare waste management is extremely key, as Martin also commented on, for having an understanding of the different aspects. So we talk in WHO about 6 different categories of waste management, and one of the key aspects is that common waste accounts for 70 to 90% of the waste, depending on your national context. And so segregation is extremely important, because otherwise we're trying to finally dispose of a far larger quantity of waste in an infectious manner than needs be. So if we're trying to use some of the technologies that Martin showed for all of our waste, well, it's not really feasible from an environmental point of view, but also from a volume point of view, your costs are going to be way out of the scale. So it's very key that waste is segregated, and segregated at source. But of course, this is only a viable, reasonable option if the different wastes are then collected separately, transported separately, stored separately, and treated separately for appropriate final distribution. It serves nothing to segregate the waste at source and then mix it later on. And of course, if there is no on-site treatment available at the healthcare facility, we recommend that an authorized and specialized service be contracted for the transport of the waste off-site, using dedicated transport and appropriate final disposal. The health sector doesn't have the correct ability to be able to do these aspects if it's not being done on site. I will not dwell on this. Martin very carefully covered all of this, but just to reiterate that autoclave is very much our #1 solution if the national situation allows such technology, followed further down the list of priorities by incineration, and then only if appropriate, the other technologies. So when we talk about waste and workers, and this is going back to something that Martin said, the use of appropriate PPE is extremely important. We need the healthcare waste managers to be properly protected from the waste that they are treating. Now, this isn't only related to COVID, this is in normal times, but it's something that I would like to emphasize because often it's forgotten. And of course, when we're talking about patients in homes, anybody dealing with the waste of the patients who are at home needs to be considered as a waste worker and be wearing appropriate PPE. We should not be dealing with masks and tissues and the waste of people who are ill at home without being properly protected. Martin presented that where you can find a lot more information online about the different types of PPE and what types of masks should be used and all the rest of it. But just to say that mucous membranes need to be protected and exposed skin needs to be protected. There also needs to be a strong component of training, not only for healthcare waste managers, not only so that an understanding of precautions and risk are there, but also on how to disinfect infectious waste and how we should be dealing with some of the bagging and transport and storage. And again, separation and segregation, as I said, and hand washing. Hand washing facilities are often not well present for all workers in healthcare facilities, and it's extremely important in times of COVID that everybody have access to soap and safe water for hand washing at all points along the chain and with frequent intervals. One of the aspects that I would like to also cover is disinfection solutions. there's been a lot about different disinfection solutions and the use of hypochlorite solutions. Hypochlorite solutions sold commercially need to be diluted in order to be used for disinfection in all environments. And there are quite clear quantities and concentrations of the disinfectant solutions that should be used. We recommend a 0.1% for disinfection of surfaces, floors, cleaning utensils, and spaces, and that is the most common disinfection solution concentration that we recommend. And so here is a table of how to dilute the commercial brought sodium hypochlorite product to make the solution. Always with appropriate PPE and always in a ventilated area to ensure chemical safety. So emphasizing again that houses where COVID patients are residing also have infectious waste, and it should be treated as such. It should be segregated and put in dedicated containers and bags and a container with a lid. The patient's room waste should be double bagged and handled according to national regulations of infectious waste, not household waste. Masks is another critical issue, given many countries are now requiring the use of masks, and the reuse and reselling of masks is being seen in much of the Americas, where it is people are retrieving used masks from streets and bins and waste dumps and washing and trying to resell. From an infectious disease point of view, we do not recommend the cutting of the front of the mask, but what can be done is to cut the strings on the side so they cannot be reused to protect people. And we are also recommending in these times that there shouldn't be recycling done from waste sites themselves. So the people who normally go and scavenge in the waste sites should be avoided if at all possible, given a lot of the waste that's around. And a lot of these things, yes, I've done the emphasis on COVID, but it applies to in many contexts, as we will hear in the next presentation, because the management of healthcare waste is often not done according to regulations. And so when a crisis or disaster happens, it is one of the issues that gets out of control very quickly and can cause quite big risks to health as well as environmental impact. This is just going to say that there are many documents available online that discuss healthcare waste management, and WASH and healthcare facilities that discusses healthcare waste management, both from PAHO, from WHO, and from other partners. So I invite you to look online for the resources. And I do believe that that is my last slide, so I can pass the mic back to Marika. Thank you.
Thank you very much, Sally. That was very important and interesting, I would say, health, environment and life-saving guidance. Thanks for also the pragmatic insights. Participants of the webinar, you can continue to post questions in the question box if there are any for our speakers, and we will then try to answer as many as we can. I would now like to invite our fourth speaker, Ms. Anna Fonseca. She's a disaster waste management specialist. She will share her own expertise, drawing from her extensive experience in supporting countries and UN agencies with waste management after emergencies. Anna, the floor is yours.
Greetings from New Zealand, everyone. Sorry if I'm a bit slow, but here it's almost 1 in the morning, so I'm actually speaking to you from the future, I would say. And my presentation will be more in terms of a global perspective, as all the other presenters have mentioned, mostly the healthcare waste. So it is, as Sally was saying, it is actually a challenge when we arrive to the ground, and you find several, as we call, disaster waste. So everything is mixed. That means that we need to understand what is the reality. So that's why, that's more or less what I'm planning to present here. So to understand more or less the concept of disaster waste, what are the opportunities that can come from that, and what are the entropies or the challenges that we face when we are on the ground on missions. So as you might know, in terms of disaster waste, it's a very broad, let's say, term or definition, because it includes all the waste that is generated from a disaster. So everything comes together, everything comes mixed, and depending on the type of disaster, you could have several options from liquid to solid, and from different types of materials. So if we think in terms of, let's say, an earthquake, you will have more collapsed buildings, as you see here on this picture. You will see more collapsed buildings. It will have more concrete. If we come to a tsunami, you will have more mixed disaster waste. So everything comes combined and gets dragged. And on hurricane as well, so it can be dragged, but it will be more focused. On a flooding, it will get, everything gets dragged again, and the different types of disaster waste becomes mixed. And this is why, when Sally was mentioning just before my presentation, that it can be very challenging when you are arriving to a disaster scene, and as it happened to us before in another mission, in a mission in the Philippines, that you are asked to go and visit a hospital, and you arrive there, and all the disaster, all the wave that came with the typhoon, the storm surge, it dragged all the hospital waste across the hospital. So everything was lying down, and they had their hospital waste or healthcare waste. They had it on containers buried on the ground, but the wave was so strong that put everything up, and we had to train people at the time. We work with WHO, we had the vaccines, and we had people to sort all of those materials in order to make sure that there was no further contamination, and it was a proper segregation and adequate disposal. So as I was mentioning, you will have different types of waste that comes on depending on the disaster. But the mainly thing will be so green waste. If we think in terms of, let's say, typhoon, a hurricane, or a cyclone, you will have more green waste down due to the winds, or if you are talking about flooding as well. So building rubble will be more mainly with earthquakes, although with the tsunami also very present. But anyway, you will find, depending on it doesn't matter what events we were talking about, you will have always e-waste, so what we call e-waste, so all the electronics and electronic equipment, including the white goods. and everyone has cleaning products at home, so they will become hazardous. So usually the vehicles are damaged and boats as well. So and they become also problematic. And then healthcare waste, as we mentioned, industrial waste, agriculture. So everything, it's kind of everything come wrapped as a present for us to try to understand what we are going to do. And on top of that, all the humanitarian aid will create also waste, will bring all the humanitarian supplies, all the goods that are provided on emergency. Everything becomes, let's say, another layer on the waste management, as we do have all the packaging that comes with the goods, with the relief goods. Everyone brings water bottles because the water is always a problem. So it's a problem on top of a problem, and we as humanitarian workers should avoid to create another layer on this waste management. So if we think, I'm going to have more practical examples, so more pictures to talk about. So if we think about earthquakes, as I was mentioning, and the general the waste that is generated, you can see here on the pictures that mainly it will be structures. So you can think about everything that. So on the first picture, you will see this was after the tsunami in Indonesia, where there was a tsunami caused by an earthquake. It was everything together. And this, you can see that there was a building and there is a vehicle crushed underneath. So for us to deal with this, we have to remove all the rubble and then remove the vehicle, dismantle the vehicle. So it's quite a complex process. On the other three pictures, you will see also structures, so buildings, residential buildings and service buildings. So the one that is lean, tilted, it's a bank. It was a bank. And you also see that the hazardous comes also with gas station. So you do have several hazardous here. I didn't put any picture on medical waste because healthcare waste, because I knew that the previous speakers were speaking about that, so I didn't. But I had we had nice bad, not bad, but less good, let's say, experiences, and good ones as well in terms of managing. We do have NGOs on the ground or organizations that are dealing with the healthcare waste in a better way, at least in a temporary solution. But we do need to acknowledge that not always what we think is the best solution are available on the ground upon a disaster. Like it was mentioning the incinerators or autoclaves. I was in countries where that is not allowed by law. So that is a challenge. So we need to find different solutions for that. Continue on the tsunamis and waste generated. So here, this is Indonesia, as I was mentioning. Here you have different scenes. You will have everything mixed together, the green, the mud. You have structures, you have infrastructures that are missing. So on the second picture, you will see there is a missing piece of this road, and it was not a coastal road before. And this brings us all together thinking in terms of assessments. What can we do? How can we reuse materials? How can we reduce the hazardous? How can we improve the environment? And how can we create opportunities to support the local economy? Unfortunately, with the healthcare waste, there's not much that we can do in terms of supporting local economy, except providing what we call the emergency employment, so training people to know how to deal and how to segregate, and what is the best way to dispose the waste. That's the only way how we can in this moment, at least with the experience that I have been included in, that's the only way that we can support local economies. If we go to the hurricanes, you have also several types of waste that can be generated. Well, basically they are more or less the same. So you have construction and demolition waste, roofs are gone. On the third picture, you will see this was a cyclone, but with a flooding effect as well. So that means that all the waste, including the healthcare waste, everything gets dragged. There are several challenges when thinking, as Sally was saying, is not only regarding COVID, it was before. So always healthcare waste and waste in general has been a challenge in terms of management. And we need to make it better. We need to make it work. We need to find solutions, but those solutions need to be adequate and adjusted to each country and to the context of the situation. And by challenges, I mean, it's not only the waste, but I think the connection between being in New Zealand and talking to the rest of the world sometimes bring this kind of challenges on turning the slides. But anyway, so going forward, so if we go and think about the successful cases and not that everything is bad, yes, it is possible. And in terms of, as Martin was saying, the digging trenches on the dump sites, it was possible for us when we work in the Philippines upon the Typhoon Yolanda. It was possible for us to get separate places to work with the waste pickers on the time that was they were working there. The waste pickers, they were engaged, and we employed them and trained them to know how to coordinate the works and where the healthcare waste was supposed to be disposed, and with signals and with everything. So this is another example of another landfill that we have rehabilitated, also with that problem with we had with the healthcare waste arriving to the landfills with bags, with everything that you can imagine. So it is possible to do, although sometimes we do lack some resources, and we are not talking about the budget, but resources that mean also the technical expertise, the equipment, you know, the space available. Sometimes it's not easy, and even the legislation sometimes is not on our side. But it is possible to do good things, and we have successful cases, not only with dump sites, but also rehabilitating roads, rehabilitating reconstruction villages, with using disaster waste as an opportunity. What else can I tell you? So in terms of challenges, I can say, as I was mentioning, it's not only the resources that are challenging, sometimes even the distance. So it is, when it's distant, it's very difficult to reach certain areas. And as Sally was mentioning, those areas, for instance, if they have someone sick, that those people will produce waste, or healthcare waste, or masks, or gloves, or anything that needs to be disposed of. And because it's a very remote areas, what happens is that no one is going to pick their waste, so they are going to bury the waste or burn it, because that's the only solution available. And it happens, and we do know that. But it's possible, as I was mentioning. So if we think in terms of the fallen trees, going back to the successful cases, if we think in terms of the fallen trees, it is possible, and it was very rewarding working on the Pacific, and also on Central America, where with the fallen trees, it is possible to provide materials for construction of infrastructures, local communities, markets, schools, roofs. It is possible to transform, to train people, to work with them, to give some capacity building, everything through the waste management or the disaster waste. I think I'm on time, right? Okay, just the last few slides, but we do come across with challenges, not only the healthcare waste, but the asbestos that is becoming very, very commonly nowadays, unfortunately, because the disasters are becoming more frequent, more strong, and that means that all the oldest buildings are have asbestos still, so that becomes a liability. It's also in terms of a challenge as resources, as I was saying, the remote villages, the ones that are more vulnerable, the shanty towns. So it's quite challenging to work on this environment. And I think I'm reaching my final slides, I believe. Sorry, but yeah, but I think that's most of it. That's what I have to talk about today. Marika?
Thank you very much, Anna. Thank you for connecting all the way from New Zealand and from Thursday, Thursday night, so from the future, as you said. And thank you for sharing all these case studies from different parts of the world. Really complex, challenging circumstances, as we can all imagine, but I hear and I see a lot of optimism also in what you presented, and that's what we all need. Thanks again to all of the presenters. I think it has been very useful, and I hope that participants have already received some answers to the questions via the question box. And now it's the time for the question and answer session, and we can give a voice to the audience as well. We cannot, unfortunately, open the floor for your questions directly, but I have some of your questions here, and I will read them, and then our speakers will be available to answer them. So the first question is regarding the residual autoclave waste, and the question is if it's possible to bury it in a special waste area at a semi-controlled, non-engineered landfill site. Martin, could you take this question, please?
Yes, it can be. That's, you know, if you've got a semi-engineered site, that means that there's some level of protection, full engineered, obviously, lined leachate controls, etc. So any of those areas can be, this waste can be placed. It's more to stop cross-infection by people coming into contact with that waste. And when we're talking about dump sites, that would be waste pickers. So to bury it and to put topsoil over, you will find that the infectious material will degrade itself, but autoclaving, you've gone through the sterilization process already. So I would still bury it if you can to prevent people taking that waste and open burning. I hope that helps.
Thank you, Martin. I hope it clarifies it to the person who was interested in the autoclave waste options. We talked about the large quantities of waste and the challenges related to managing them. In this regard, we have a question on the advice given by WHO regarding disposable single-use masks. Sally, could you advise us on this? Is it possible to reconsider the advice given by WHO on this?
Thank you. WHO right from the beginning has really only recommended single-use masks, medical masks, for very small segments of the population. They are mostly reserved for healthcare workers themselves and people in healthcare settings themselves. There are a few exceptions to this, and these are mostly the people who are in great heightened vulnerability, such as older members of our population and people with very critical fundamental disease problems. For the general population, WHO has never recommended medical single-use masks. If you ask me if I would recommend that nurses and doctors in healthcare settings treating patients could wear a different type of mask, no. We need our healthcare workers to be sufficiently and adequately protected from these respiratory conditions. But it is only a small proportion of the waste that is the masks anyway. There is a huge amount of other waste that is being generated, which we need to take into account. Thank you.
Thank you, Sally. The next question is concerning the fact that we have these practices and a lot of guidelines, but how well are they upheld, especially in developing countries? This is, of course, a very broad question and the situation varies, but I was wondering if Anna could address this question and also perhaps share your experiences, any examples, what you have seen in cases where waste companies or institutions actually would not follow any of the guidance. Are there any consequences, and how has this been dealt with? Thank you.
Well, upon a disaster, the situation is a bit different because you have a period of emergency. We call it emergency. That is the first month or so. That means that no one basically needs to follow anything, because it's an emergency, so it's a saving life operation. Although we tend to make sure that things are in line with the proper management in terms of waste management. And we keep on pushing things since day one, but because the legislation, because there is this period of emergency itself, they don't need to. But I do know about countries that after this period, fines were applied. Although it's quite tricky because the country is in a situation of economical difficulty. That means that it's a tricky, it's a tricky thing to apply fines when actually the country is already suffering. So what we try to do is to work with the institutions, so not only the companies that I've visited a few in order to make sure that they are, if we think in terms of waste management, some scrap dealers, so the ones that deal with the scrap. So what do they need to put their business back again to help us to deal with the amounts of waste that we find on the streets? And so sometimes it's small things that we can do, so we can improve their organization and they can start work again. Because most of them, when we are talking in terms of disasters, most of them, they are affected. So sometimes they don't have the means to keep on doing their work, So it's at least that's my experience. Thank you.
Thank you, Anna. Then we have a question regarding the options that could perhaps exist for safely storing waste and then opting for regular waste management mechanisms, considering that the residual times of the virus is 2 to 3 days. Could this be safely done? Martin, can you comment on that? Do we have enough research and information about this kind of scenario?
Yeah, this is a very good question, actually. The table that I showed was from various studies that have been done showing literally the virus and its lifespan on surfaces. So we at first felt that, well, maybe it just decomposes over time. It does. But can we then treat waste in a way that we could store waste and hold it back for a while, and then it would just become safe waste? But we've found out that this is not the case in the sense that because the waste is all combined, and there may also be mixed with other pathological waste as well, which then would be a problem, and it may actually increase the infectiousness of that particular, there may be some form of reaction. So, but in the case of, because you cannot guarantee that it would be composed over a certain period of time, it's not a safe step to take as a solution. However, what we've done, I deal with peacekeeping missions, and we've had quarantine because we've had lots of incoming troops coming into the missions, etc., up to 6,000 at a time. So we have these very large quarantine camps. And because they're under quarantine, you don't know whether they're infected or not. So we do hold back their solid waste. All their PPE is segregated, and we treat that as infectious waste, but their general waste, which could potentially also be infected if they were found to be infected at a later date, we do hold that back 72 hours until we send that to the normal waste procedure. So yes, I think it can be done, but if it's infectious material that should be deemed infectious, you should try to deal with it in one of the solutions that we suggest. Over.
Thank you, Martin. So whereas that was about the possibilities of using regular waste management practices, we have a question about low-income countries where even under normal conditions, garbage is not collected systematically or safely. This question is also a challenging one. So when we have people in households living in quarantine at home, how could we organize a safe waste collection system in low-income countries? Sally, could I pass this to you, please?
Thank you. It is a huge challenge, not only in low-income countries. It's a logistical challenge with the number of people that we have at home who are patients all over the world. Not necessarily only those in quarantine who were not sure about their status, but even those we do know their status. It is, however, a problem always. We have people who self-medicate with all sorts of sharps and who are undergoing chemotherapy and therefore have waste, which is also a challenge and shouldn't be put into the general waste system. Different countries have instituted different mechanisms where patients can take it to their clinic when they go. You segregate it and then take it, or different things. There is no easy solution to it, and a lot of people struggle with this in many different circumstances. But double bagging it, labeling it, storing it for several days is what many countries have recommended, and then putting it with your common waste, because it's the only way that they can deal with it.
Thank you for this, Sally. The next question is regarding disaster settings. So I would like to address this to Anna. It's about plastic waste generated, especially after landslides and floods. How can that be treated or managed in such condition?
So you said after landslides and, Marika?
After landslides or floods, how to treat contaminated plastic waste?
Okay, if we think just in terms of the plastic itself, let's think about plastic bottles. We had an example back in Indonesia in 2004. So they collected all the plastic bottles and they filled the plastic bottles with the mud and the sand from the tsunami, and they fill it and they put as a fence. You know, they created a fence to make sure that they have at least their livestock there, or to start doing a bit of what they call gardening. That is actually starting to be a bit of agriculture. That is an example of Indonesia. So, and we do have, I remember there was another example from, let me think, Sierra Leone, if I'm not mistaken, where those, talking about plastic bottles again, it is possible to build exactly with the same technique. So you will fill the plastic bottles with mud or tiny rocks, and you will get as a gabion. You know what is a gabion? To put just to content the walls or the land, and that would create also a way to recover instead of going to a landfill or a dump site. I'm not sure if I answered the question.
Thank you, Anna. Participants can continue to comment in the question box or ask for further clarification if needed. Then we have a question about managing landfill sites. How is it possible to do in a way that is both biodegradable and sustainable, but will minimize fire risk and helps to make cities smart? Martin, can you take this? Thank you.
Okay, well, you have two types of landfills, really. You would have a solid waste landfill, but separate to that, you would always a hazardous waste landfill. Now, the ideal landfills are obviously fully engineered, and these will be fully lined. They will have secondary liners, or they would have an impermeable base, such as a clay layer. They will have leachate containment. They would also have some form of methane flaring. So solid waste, for example, produces a lot of methane because of the decomposing material. The plastics don't decompose really, but they just break down and become brittle into smaller parts. But the actual organic waste will break down. So you will, if that's actually separated, that's even a better process. And what we're seeing in many cities nowadays is that people are now, being encouraged to segregate their organics, and these go off for composting. And by going through that process, you're reducing the global emissions, the greenhouse emissions from those particular landfill sites. In respect of infectious waste or hazardous waste, really to do it properly, they need to be fully engineered, and they need to have extra precautionary measures taken to ensure that any leachates are collected and cannot sort of, pollute the surrounding environment. So making cities smart, I think, encouraging proper engineered landfills and proper segregation of waste, where you then have the choice to place waste in different areas and to deal with it in different ways. Recycling, for example, that would all help with sustainability and improving the whole waste process.
Thank you. Now I'd like to ask Sally if it would be still possible to save some resources, considering that there's now so much COVID waste being produced. After proper treatment, would it be possible somehow to reuse or recycle the COVID waste so that we can save some resources?
Thank you. The recommendations on PPE, as both Martin and I referred to, are set out in WHO documents. Not all of these are disposable items. Several of these items are reusable, recyclable items that are cleaned, disinfected, stored, and then reused. There is also investigation underway on using UV light and other ozone technology for excuse me, disinfecting other types of PPE, but as yet a lot of the research has not come back certainly very positive on things like disposable masks because of the multiple layer and filtration functions that they perform. But there is research going on underway about these within healthcare facilities themselves. of course, the recommendation to the general public when they are required to use masks is to use 3-layer hygienic masks according to WHO specifications, but which can be washed and reused. The general public is not recommended to use disposable single-use masks, and nor is the general public recommended to use gloves or some of the other items which are frequently seen being used. However, in a home environment, some of these items must be used, but there are ways of using items which can be disinfected, and these are all explicitly written in the WHO guidance that Martin had the link to. Thank you.
Thank you. I think we can still take a couple of more questions. And now we move to considering developing countries and the high urbanization rates that actually result in urban slums, where obviously also great quantities of waste are being produced. Anna, could you share some guidance and your experience on how to handle this kind of challenge, waste management in urban slums?
It is a big challenge, indeed. I'm not sure if we are talking about the same kind of slums, but I will refer just in terms of a disaster point of view, because that's the experience that I have. So as soon as a disaster, we are upon a disaster, and there is an event that cause destruction, that means that slum would be the most affected one, because they are the ones with less infrastructure, they are densely populated. That means that everything will collapse. If we think in terms of, let's think in terms of non-disaster setting. So non-disaster, that means that everyone will produce a lot of waste. So regular collection needs to be put in place. They are communities organized to collect their own waste. So they will delegate depending on the organization of each community, they can delegate one person per, let's say, per area, per zone, and with certain collection points, and then the truck will go there and pick it up. But it depends on the context of each community. It will depend on the setting of the community, on the layout of the community, because sometimes those slums are so narrow that no trucks go in. That means that it needs to be collected by hand, sometimes with wheelbarrows that happen, or with small trucks or on tricycles. I saw those happening in several countries. So there are options. So it's not like an excuse to have the waste lying down everywhere, but there are options. But sometimes it's difficult to have agreement between the communities and the local authorities, I would say.
Thank you. So today we have focused mostly on waste management in the COVID-19 response, but obviously COVID-19 is a huge challenge to societies all over the world. It's of course first and foremost a health and medical challenge, but also an economic one. One of the participants would like to understand or hear your insights on how big of an issue is waste management in relation to the other aspects of this crisis. Sally, would you like to comment on this?
Thank you. I think this is a very complex question because we're not comparing the same type of things. Clearly, the medical aspects of COVID are treating patients. Does healthcare waste management influence that? No, not at all. Those are normal settings. But healthcare waste management does influence the protection of people and the prevention of the spread and infectious spread, and also the economic, because in many settings there isn't sufficient PPE to be used as per the guidelines, and so corners are being cut, which increases the risk of infection to the healthcare workers or the carers at home of COVID patients who can't get their hands on the correct PPE. Is this a waste management issue? Well, in part, yes, because if you don't have the correct amounts of PPE, either or possibly due to economic reasons or maybe just due to global procurement issues, but the management of that PPE is ever more urgent and critical due to its infectiousness. So it's very difficult to compare the different things. Yes, they're interrelated, but yes, the management of waste is a considerable challenge and a potential issue or a real issue. As I said in my presentation, because masks are being made mandatory, people are taking masks out, or single-use masks out of rubbish bags and reusing them. This is not good practice by any stretch of the imagination. So correct healthcare waste management is very, very critical component of prevention, infection prevention and control. Thank you. I hope I answered the question.
Thanks, Sally. I think you did, and indeed difficult to compare, and probably also a bit early to say. We do not really know yet what is happening and how all waste is being treated all over the world. So time will tell when we can later run some assessment on what happened and what were the longer term consequences also of waste. I think it's time for the last question, and this is regarding a cross-border setting. When we need to deal with waste in disaster management setting, what are the constraints that you have come across in this kind of situations, Anna, as you have worked in different parts of the world? You have some insights to share regarding the constraints in cross-border situation.
So I believe the question is to be related with the two countries that are affected by, correct? Yeah. So I never been in that situation before. So because usually you are based in only one country. So and you have people deployed in other countries. And when it's required, we can work together. But I never work in two countries at the same time. But what I do know is that legislation can be a constraint because countries manage the waste in different ways. Although there are guidelines, best practices, and things like that, the economic situation is not exactly the same in all countries. The technology available is not the same. So that means that the constraints will be different in between countries. If we think, let's say, a very easy example will be Haiti and Dominican Republic. They are the same island, two different countries, two different contexts, two different legislation, and two different ways to deal with the environment management itself. So even if you look at the satellite image on that specific island, that are two countries, one is green, the other one is not. One has forestry and the other one has deforestation. So, and I think this is a parallel comparison, but the waste management will be exactly the same. So it's going to be difficult to have the same kind of legislation in between two countries, the same kind of technology available, the same kind of best practices. So this needs to be worked case by case, country by country. Thank you.
Thank you, Anna. And I think that wraps up our question and answer session. We're approaching 3:30, so that means we're very close to the end of the webinar, and it's time for me just to give a few closing remark or concluding remarks. Now, through the different interventions and questions that we received from the participants, I think we can really grasp the urgency of ensuring that environmental considerations are anchored to the humanitarian response at the earliest stages to prevent any escalating and cascading shocks and impacts which eventually undermine the very purpose of humanitarian action. This becomes really apparent when dealing with crisis waste management. Our speakers today gave us many examples from their own experiences, and these have also clearly shown us that waste management is a prominent environmental concern during emergencies, and we must do all that we can to support countries and communities in facing these challenges. And as Atul said during his opening remarks also, this has been the latest, but a very powerful wake-up call about the links between environment and emergencies. It has affected us all. It has made us all accountable. And we've seen that unfortunately, those who were already suffering from disasters, conflicts, violence, discrimination, and unequal access to basic services and living conditions are bearing the brunt of this new crisis, with healthcare and infectious waste management posing public and health environmental risks. But I think we've all seen worldwide and also in our own lives that this crisis can bring us together, and it has shown us that we can achieve quite a bit when we all come together. So the lesson learned from all of this is that we need to reconnect with nature. We need to ensure that we move forward into more sustainable pathways for our future. And we need to harvest some of this experience that we are now gaining, collect best practices, see what we have achieved through collaboration, and try to build a more resilient waste management systems in the future. It's now time for me to thank again the speakers, all participants for their active participation, and thank you for joining the webinar today. Before we close, I would just like to remind you that you will receive an email with a link to a feedback survey. I encourage you to fill that in, as it will be very helpful for us as we move forward with this webinar series. Upon completion of the survey, you will receive the link to the recording of this webinar, as well as all the presentations and a certificate of attendance should you need that. Finally, I warmly welcome everyone to join the next webinar. It will be held on 14 October, and it will focus on chemical risks and restarting industry after the COVID-19 lockdowns. Thank you all, and keep safe.
Thank you.